Hi, I'm Richard Kaufman with the Bethesda Research Institute. I'm also a vice chairman of the Economists for Peace and Security group. I want to make a very brief comment before our panelists begin their presentations, and that is about the crisis we face at all levels of government, national, state, and local, and why it is so difficult for the federal government to respond in the sensible ways that the last speaker or the last panel outlined. And also why policy has gotten so crazy, as was detailed by JB and the first group of panelists. And my explanation is this: two basic factors. First, severe economic downturns are historically a devil's playground for extreme and irrational solutions to common problems. Of course, it is no comfort to know that we are in the midst of a recurring phenomenon. Second, there is in particular a brooding omnipresence, to borrow a phrase, in Washington. It began with the election of Barack Obama, when the Republican minority in the Senate managed to use the spongy definition of the filibuster to slow down the policy process and defeat a number of administration initiatives. This process has been accentuated with the election of a Republican majority in the House of Representatives. As Representative Woolsey said, the House Republicans threaten to shut down the government when they don't get their way, a phenomenon we all witnessed last week, and we will continue to witness for the foreseeable future. Well, I want to turn to our panelists, who will discuss the national responsibility to the crisis and present some very interesting ideas about possible courses of action. And we will begin with Steve Atwell at the University of California in Santa Barbara.
All right, thanks very much. So just at the outset, let me warn you, I'm not an economist. I'm actually a policy historian, so expect to hear about history and the past. So I'm actually here, apropos of the last comment, to talk about unemployment and to talk about how we deal with it and how we can deal with it. So the problem as I see it is that right now we're stuck in a really big hole when it comes to jobs. You can see we've got 13.5 million officially unemployed. We've got another 15 million unofficially unemployed, which would be a huge hole to climb out of in any economic situation. But we also have a long-term problem in our labor market that means that any time we try and do something about it, we're always running against the current. And what makes it even worse is that the main policy that we have, our automatic stabilizers, to deal with unemployment is fundamentally broken. And we can see this, right? Labor force participation rates. It's been incredibly difficult even to get them to go up a little bit. They've now fallen, through the floor. This is U6, the broader unemployment rate. And one thing I want to kind of draw your attention to as a sign of a weakness in the labor market is that each time we, get to the best part of economic growth, right, when we hit our peak of the economy, the floor ratchets up each time with a cycle. So, in the late 90s boom, we hit a U6 of about 7%, but then following the next kind of crash and boom, we're up to we're up to about 8%. And the thing that really terrifies me is what the new normal is going to be after this recession, because it looks like our policymakers are dangerously comfortable with current levels of unemployment. And we can also see that it's taking us a lot longer to come out of recessions because our labor market is just not functioning as well as it ought to. So here's what's wrong with unemployment insurance. It's basically got a flaw built into its very design. In 1935, the Committee on Economic Security that created Social Security were faced with the problem of a Supreme Court that was likely going to strike the whole thing down. And so they basically did a dodge that was hinted to them by Justice Louis Brandeis, that if they passed a federal regulatory tax and then forgave it against states that set up their own unemployment insurance programs, that would be deemed a constitutional exercise of the federal government's authority to tax. And the thing I want to note here is that this was a tactical consideration. It was not what they, philosophically or ideologically wanted. Well, this creates a dangerous vulnerability within the unemployment insurance system that can't be expunged. 49 states have a constitutional ban on deficit spending, 26 have borrowing limits, and as a result, you get this situation in which 32 states in this last recession have had to borrow billions of dollars from the Department of Labor because they underfunded their systems. States don't have the ability to deficit spend, so what happens when we hit a recession is that revenues plummet, demand greatly increases, and they've got nowhere to go. And what makes this worse is that the state-run nature of unemployment insurance creates powerful incentives for states to basically game the system and underfund their UI reserve funds deliberately, because the lower the uninsurance tax rate is, the more attractive you are to out-of-state businesses that you're trying to lure in. There's a lot of bidding wars between states. You get a lot of situations in which companies basically pay no tax, or the state pays their tax for them. Another outcome of this is that states have an incentive to exclude workers from unemployment insurance and to keep benefits down. The main methods of exclusion include having high minimum contribution requirements, which means if you're a low-wage worker, you just don't make enough to get in. To have long periods of employment that you have to have before you're eligible, which tends to knock out part-time and temporary workers, or to simply exclude all non-full-time employees by statute, as happens in some cases. As a result, only about 40% of workers in America are actually eligible for unemployment insurance, and only about a third actually get it. Another way that states try and deal with their problem is by keeping the benefits really, really low. As you can see on this chart here, Mississippi, Alabama, Tennessee, Louisiana, and Arizona all have rates that are either at or right below the federal poverty line for a single person. So imagine what that does to a family. The national picture isn't that much better. Our average is about $300 a week. That's well below a poverty line for a family of 4. And what this means two things. One, it has a huge kind of social cost to people in unemployment. Their income drops through the floor. But it also has an economic impact, right? Instead of acting as an automatic stabilizer to falling consumer spending, we just kind of drop down to a lower level of equilibrium. We don't bounce all the way back up. And corporations have also gotten into the game by hiring, first of all, by redesignating employees so that they don't qualify for unemployment insurance, calling them outside contractors even though they only work for one company, or increasingly by turning to professional unemployment insurance claims challengers. This is Talcs. They're a company that's become notorious in Arizona for challenging people's claims, and they do it in incredibly shady ways. One of the most common ways is to fire people on a Friday, call them up on a Saturday and say, hey, we'd like to hire you back at half your original pay. And when the worker, quite understandably, tells them to go to hell, they then turn to the courts and say, oh, well, they just refused an offer of bona fide employment, terminate their unemployment insurance benefits. That's one of the strategies that companies like Talcs tend to promote. So the solution for this is ultimately we have to nationalize unemployment insurance. A decentralized system will not work. It simply creates way too much of an incentive for a drive to the bottom. And I think the nationalization has to come on three principles. One, everybody has to be inside. Two, there has to be a national minimum benefit. That means becoming unemployed does not mean becoming poor. And three, we need a supplemental benefit for families that have children. Luckily, this is actually easier administratively than we think it is. We already have a federal unemployment tax that we forgive against the states. All we have to do is essentially stop forgiving that and then set up on our own. The extension of coverage to all workers, we're already seeing a gradual process in the 2009 Stimulus Act. One of the more controversial elements that passed through, if you remember, was a money for the states in incentives if they expanded their base periods of employment and if they agreed to cover part-time workers. And I would argue that the resistance to this by conservative governors has as much to do with preserving a low-tax, low-wage, low-labor cost economic model than it does with, trying to become a Republican nominee for president in 2012. So now I want to talk about something completely different. Unemployment insurance, if we fix it, that's great. But I think there is also a missing link in our welfare state. We have no way of keeping people from losing their jobs, providing new jobs when the private sector isn't hiring, and cushioning people against the social costs of unemployment. Interestingly, creating such a system would not be a radical departure from the way we've talked about things in the past. In 1935, when the Committee on Economic Security was trying to think about what do you do about all of those millions of unemployed workers who had never paid into unemployment insurance because it hadn't existed yet, they basically said, and you see the quote here, we must stimulate private employment, fine, but in the end, we must directly provide public employment to people out of work. And I think this can be done with three kind of legs. One is an American labor market policy system. The other is what I will describe as job insurance. And the third is dealing with the social ills of unemployment that make it hard for people to get new jobs. So one of the strange things about the way we do things is that we only react after people have lost their jobs. And we know that one of the consequences of doing that kind of approach to unemployment is that when people get that second job, it's usually much worse. The wages are lower, the benefits are worse. So there's an entire suite of labor market policies that are used all over the world that prevent that from happening, that keep people in their jobs, keep them productive. One very simple way is what the Germans have done. They simply just directly pay employers to keep people on staff. We did a kind of a mini version of that with the new job. So we could make that permanent. We could say, all right, when you are announcing a mass layoff, we will provide you 50% of their wages by tapping into unemployment insurance, right? You provide that money so that so that they don't have to grab 100% of their unemployment insurance and they can stay on the job and keep working. A second option is used in Sweden is to do a similar thing, but to say, okay, instead of just not firing people, why don't you send them to college? Why don't you send them to a training course? Help them get skills. Help them, remain as attractive an employee as you possibly can. And then finally, recruitment grants, net new jobs grants, which are a little bit more problematic, I admit. But now I want to talk about what this heck is job insurance. So in 1935, the Committee on Economic Security is talking about, okay, how do we do provision of jobs? And this guy, Emerson Ross, who was a member of the executive staff, who had previously worked for FERA, the Federal Emergency Relief Administration, who had worked for the Civil Works Administration, and would go on to be one of the administrators of the WPA, said, well, I think there are three different ways we could do it. Oops, okay. One, we could just have a work insurance system and then a general work program for people who aren't covered by work insurance. So unemployment insurance would be completely eliminated and it would never have existed. Two is that you would merge work insurance with unemployment insurance, that after 26 weeks, your benefits are up. Instead of either continually extending your benefits or leaving you, on the street, we say, okay, we'll give you a job and you get back to work. And then the third one was that the work program and unemployment insurance would be completely separate. That's what we ended up doing, except the WPA got terminated in 1943. But for a period of about 8 years, we did have this third option in practice as the WPA and Social Security continued together. So here's how it would basically work. Directly providing a job costs at about $24,000 a year in wages, costs about $35,000 to $40,000 a year. That's not just me saying it. This is basically the same estimate that Alan Blinder at Princeton, Larry Mitchell at the EPI, and surprisingly Kevin Hassett at the American Enterprise Institute have made. So 1 million jobs roughly works out to $35 billion per year, which actually looks pretty good compared to the stimulus, which is at about $195 billion per million jobs. The federal government could easily do this on its own. If they wanted to employ everyone officially unemployed, it would cost about 60% of what the stimulus cost. But as we've seen with Social Security and as we've seen with Medicare, creating a social insurance system creates bulletproof politics, right? People who are paying that payroll tax are not going to give up the benefits that they feel that they've earned. Workers on job programs would be seen by universally everyone to have earned their public jobs, so that we wouldn't see the same kind of shaming of the unemployed that we see today. And then finally, the program itself could be deficit neutral, so we wouldn't have to fight the deficit hawks on every last penny. A 1% equivalent of payroll tax, I prefer a sliding scale premium, would provide about $36 billion a year. That would go into a central job insurance fund. After about 3 or 4 years, this fund would be large enough to immediately respond to even pretty big job losses. It'd have to be 7 years to be ready to handle the Great Recession on its own, but it's clearly doable. The idea is that you would then, that money would operate through National Labor Market Board, which would set national policies, approve projects, distribute funds down to the state and local level. If this seems implausible to you, I'd like to let you know this is how Sweden operated from 1930 through 1990. They've liberalized a little bit, and they maintained an unemployment rate of less than 2.5% that entire period. That's better than the US has ever done. Finally, curing the social ills of unemployment. The last sort of remaining thing that we don't do very well is preventing the loss of a job from becoming a barrier to getting that second job. One of those barriers is that unemployment can very quickly become homelessness if you're dealing with one of these massive mortgages that suddenly balloon in your face, as many people did. North Carolina and Pennsylvania have already established home protection funds, which basically provide zero interest loans to unemployed homemakers who are in danger of being foreclosed on. This is not also something new. This is basically what the Homeowners Lending Corporation did in the 1930s. Also, health insurance. We have COBRA. The problem with it is that it's incredibly expensive because the entire cost pretty much is borne on the shoulders of the individual. We did have this temporary subsidy under the Stimulus Act, but I think a long-term better strategy is to simply let people buy into either Medicare or Medicaid or the federal employees program, whatever it is, so that you don't get situations in which people lose their health insurance, they don't get checkups, they don't deal with medical conditions until they become disabling, then they're disabled, then they can't work. And then finally, I think we have to allow UI recipients to attend jobs or training in lieu of a job search. Right now, in some states, if you go to school instead of just looking for a job, that could qualify you for losing your benefits. Now, that's under the assumption that we don't want people to be dependent and that it's easy for people to get jobs, in part because it's, these assumptions were created during times in which our recessions were very sharp, but we had a very quick bounce back. I think given that we've seen that we have a labor market that won't bring people back in very quickly, that we have to allow people new ways of improving themselves. Thank you. So I'm actually going to conclude a little bit early. In the end, I think that this dual approach of nationalizing unemployment insurance and creating a federal employment assurance system is both a moral act and a necessity. It's a moral act because it is simply wrong for people who want to work to be denied that chance to contribute to our nation's economy. Work means more than just a paycheck. It determines our very social identity. It's when we wake up in the morning. It's why we read the newspaper. The simple process of going through a commute and into your workspace and meeting with your fellow colleagues creates a sense of identity. It's a mass experience. And without it, people are left behind in residential neighborhoods, each day being reminded that they are useless, that they are not needed. And as William Beveridge in 1944 understood, even as he was proposing a national welfare state that would provide people with unemployment benefits, he says that's not good enough. Because at the end of the day, even if you've got that unemployment check, you are still being told by society that you are surplus to requirements. And that fundamentally we have to respect the value of labor that the unemployed represents. It's also a necessity because of that value. 28 million officially and unofficially unemployed workers equals $3 trillion in output each year that we never see, right? And if we're talking about solving the state and national fiscal crisis, we're never going to get there. California is never going to fix its fiscal system, no matter what policies it tries to enact, when it's dealing with 12% unemployment year after year. That's just too big a gap to try and make up. But I think, as I've shown, there is a way that we can do this if we look beyond the traditional ways of dealing with unemployment and seek a new path. Thank you.
Greg Anrick.
Thanks very much. And this is something of a sequel to Steve's presentation. I'm going to focus on Medicaid and have many similar ideas about what ought to be done to Medicaid as what he was suggesting ought to happen to unemployment insurance. The main argument I'm going to make is that we should do the inverse of what Congressman Paul Ryan recommended last week in his plans for reforming the budget, and particularly Medicaid. He would convert the existing Medicaid system. Medicaid is the federal state health insurance program for the poor, the disabled, and many elderly who are in nursing homes or otherwise need assistance with their living. And his proposal would be to shift it so that it would become a block grant. States would be given a fixed amount of money and that they would have even more leeway than they already have, which is significant, to do with as they please with that money in providing health care for the same group of people. Over time, the amount of the block grant that states receive would not be allowed to increase any higher than the rate of inflation, general inflation in the economy. As I think you all know, healthcare inflation historically has been much more rapid than general inflation, and so therefore it's all but certain that the amount of money available to states to spend on Medicaid would, relatively speaking, decline relative to the costs that they'd be facing. I'm not naive at all by looking at the current political circumstances and saying the idea of what I suggest, which is to federalize Medicaid, the exact inverse of what Congressman Ryan is proposing, is unlikely at this stage. But I really think his proposal creates a new opportunity by drawing contrasts between what he's proposing and what the system might be like if we were entirely run by the federal government, to underscore why his ideas are bad and our ideas would be preferable from every standpoint, not just in terms of extending coverage, but also in terms of controlling costs throughout the healthcare system generally. I recognize that this would take many years to reach that point in terms of politics, but that's always the case. And really, it's time to start coming forward with an alternative vision rather than just defending the existing status quo with Medicaid, which is indeed a very flawed system. It has many shortcomings. The shortcomings arise, though, from its dual federal-state nature, which involves diffuse accountability. And when there's diffuse accountability, when people don't know who to blame, no one's to blame, and problems persist for years, as they have ever since Medicare and Medicaid were founded. When Medicaid was created back in 1965, it was designed by the chairman of the House Ways and Means Committee, Wilbur Mills at the time. He was a Democrat from Arkansas, a very fiscally conservative Democrat, and while he, along with Lyndon Johnson, was heroic in the creation of Medicare, Will Mills was very conscious and concerned about the possibility that these programs could become an entering wedge into the idea of a national health care system that would be mandatory. And so Mills made sure that Medicaid had this federal-state dual accountability, much as all the other welfare programs that existed since the New Deal had. He knew what he was doing, and it's been very effective. It's very difficult, given the current structure that it has, to transition it into something that would quickly become part of a national health insurance system. Although as I will talk about in a minute, the new health care legislation does take significant steps in the direction of creating the potential for Medicaid to become more of a federal program. Okay. The formula, by the way, that has existed since Mills created Medicaid has been to make the poorest and least populous states get the highest share of federal funding. So states in the South, particularly low population states, get up to 76% of their funding for Medicaid from the federal government, whereas the more populous states, usually blue states, not incidentally, get 50% from the federal government. So here, there are a number of problems with Congressman Ryan's plan, which really amount to exacerbating the existing problems with the current Medicaid system. First, here's what the Congressional Budget Office said in reviewing Ryan's plan. CBO said, federal payments for Medicaid under the proposal would be substantially smaller than currently projected amounts. States would have additional flexibility to design and manage their Medicaid programs, and they might achieve greater efficiencies in the delivery of care than under current law. Even with additional flexibility, however, the large projected reduction in payments would probably require states to decrease payments to Medicaid providers, reduce eligibility for Medicaid, provide less extensive coverage to beneficiaries, or pay more themselves than would otherwise be the case under current law. Another certain outcome under a block grant system is that we would have even wider variations than we already do from state to state in terms of who is eligible for receiving coverage. In Minnesota, at the very high end, working parents with incomes up to 215% of the poverty level are eligible for Medicaid. In Alabama, in contrast, the threshold is just 24% of the federal poverty line. That amounts to $4,450 for a family of three, which is, you can understand, doesn't lead to many people being covered there. Ryan, though, says that the existing Medicare reimbursement structure encourages states to extend coverage to those who are not truly needy. But the least generous states, like Alabama, currently are those that receive higher matching payments from the federal government. So that basic argument that the existing system somehow encourages excessive generosity is, on the face of it, absurd, and then it doesn't even hold up in terms of looking at the actual numbers. Even as it stands, studies have found that about 1 in 4 non-elderly Americans without health care coverage who are eligible for Medicaid or CHIP but not enrolled in them. That is, they would be able to get in the programs, they're qualified for them, but they're not enrolled in them for a variety of reasons, some of which include the states themselves don't exert any energy into trying to recruit people into entering those programs. In Mississippi, only 36% of its eligible residents were enrolled in Medicaid. And Mississippi is like Alabama, it has very stringent eligibility requirements. So even among those who are eligible, only a small share actually enroll in the program. Again, under a block grant system where states are under pressure to continually cut their spending, you can imagine the eligibility requirements will decline, and then the efforts to reach out and enroll people likewise could be expected to be reduced. Another likely upshot of the Ryan proposal would be reductions in the services covered by those who end up on Medicaid. Under federal law, currently, eligible beneficiaries receive coverage for physician services, inpatient and outpatient hospital services, and home health care services for individuals entitled to nursing facility care. Those are mandatory requirements from the federal government for those who are deemed to be eligible for Medicaid in those particular states. Many other areas are optional to states, like prescription drugs, dental care, clinic services, some mental health services, and so on. For high-cost elderly and disabled beneficiaries, expenditures on optional services currently constitute the majority of spending. If states have even greater flexibility in determining what services that they pay for, there's every reason to expect that the menu of covered services will be further reduced. In addition, reimbursement rates to healthcare providers, which states already have wide latitude to set, would be sure to drop even lower. Already some states like New York and New Jersey pay healthcare providers less than half of what Medicare pays to them. That obviously discourages providers from taking on Medicaid patients, which in turn leads to poor healthcare outcomes for many Medicare beneficiaries. In New York State, even though the menu of options covered by Medicaid is broader than it is in most other states, its healthcare outcomes are among the poorest in the country, and in large part that's due to the high numbers of Medicaid patients who end up going in highly institutionalized settings. They're overcrowded, that provide very limited individual attention. So again, all these, if you have low reimbursement rates, if you have more stringent eligibility thresholds, you have less outreach, all of these are problems that exist with the current program are only going to get worse if the states have even greater latitude to try to manage the program in an environment where they're constantly having to cut spending due to the very strict limit that's been placed that would be placed on how much they have made available to them. Another factor, too, to keep in mind is that because the amount of money that would be available to states would be across the board limited, for states that for demographic reasons or for economic reasons going forward have more significant costs confronting them, that wouldn't be accounted for by an across-the-board flat ceiling that would be provided under a block grant system. So that's yet another thing to be concerned about. So let's shift gears and look at the opposite approach, which would entail increasing the federal government's control of the program and ultimately taking it over. One of the main rationales for federalizing Medicaid is that the program is the primary reason why states are expected to face chronic budgetary shortfalls even after economic growth resumes. Robert Ward in the last session mentioned the Government Accountability Office projections showing sort of indefinitely states confronting a budgetary squeeze even after the economy improves. The GAO forecast said that states, because they have to balance their budget, would year in and year out on average have to either cut spending or raise taxes by the equivalent of 12%. And so you can imagine if that were to be the case going forward, that's just constant pressure on states to cut spending on education, social services, and so forth. And that's just untenable. Something has to be done to alleviate that squeeze. And because healthcare is the central problem, and because having a highly fragmented system of running healthcare is the reason why our system is so much less efficient than it is in other countries, really attacking that problem head on in one way or another requires going after Medicaid and trying to find a way of bringing it more deeply into the federal system. So let's talk about the Patient Protection and Affordable Care Act, which, by the way, Congressman Ryan would repeal, which takes important steps in the direction of federalization. The goal under that law is to expand the program's enrollment from today's roughly 60 million to about 85 million by 2019. That would mean that about 30% more Americans would be on Medicaid compared to Medicare in the future. And the main way that it would be expanded would be by extending eligibility to all non-elderly Americans up to 133% of the poverty level across the country. There you can see right there, that's a very different set of circumstances than we currently have. And it was passed, Congress passed this. So but for those that say, well, we can't imagine Medicaid becoming federalized, this is a big step in that direction. And at least unless the courts don't shoot it down, it looks likely to happen. To implement that, the federal government would pay 96% of the cost of expansion over the next 10 years. Under the health care bill, the feds cover the entire cost of newly eligible enrollees for 3 years. And by 2020, the federal government would still pay 90% of the cost for those new enrollees, which is much higher than the normal rate. The higher matching rates are obviously intended to induce states to be willing to take on new Medicaid enrollees. The uniform threshold that would apply nationwide of 133% would go a long way toward alleviating the state-to-state variations in coverage. Of course, that's why it's also meeting such intense resistance. But there would still be significant variations under the legislation, even with the individual mandate, because some states will remain far more energetic about outreach and enforcement than others. The bifurcated responsibility between the federal government and states, even under the Affordable Care Act, would remain problematic. So here are 4 arguments for federalization that have the potential to carry significant political weight going forward. As the Affordable Care Act is carried out, and we want to try to build on the movement that it's created, how can we continue to move further in that direction and further incorporate Medicaid into the federal system? One argument is that Americans will have to pay Medicaid's costs one way or another. Because state taxes are much more regressive than the federal income tax, as we heard in detail about, moving toward federalism would shift the cost burden to a greater extent toward those who can most afford to bear it. The second argument is that America's interrelated problems of soaring medical inflation, mediocre care, and a huge uninsured population are an outgrowth of our highly fragmented healthcare system. Federalizing Medicaid would reduce that fragmentation, giving the federal government much greater leverage to control overall healthcare costs. Almost all the cost-saving reforms in the healthcare legislation are applied only to Medicare, because the feds can't sufficiently manage Medicaid as currently structured. Federalization would allow successful cost-saving changes to be extended much more broadly through Medicaid as well. Federal outlays would increase substantially at first, but down the road, the rate of healthcare cost increases would likely decline more significantly and rapidly than it would otherwise, as these cost containment elements of the healthcare legislation that are in place for Medicare could be extended as well to Medicaid. Simply shifting even more cost onto the poor through Medicaid block grants wouldn't change the structural flaws in the healthcare system that produce high medical inflation and poor health outcomes. Another benefit of federalization is that during recessions, when state balanced budget requirements lead to Medicaid cutbacks, the federal government would have greater flexibility to make sure low-income individuals are adequately covered. And finally, reimbursement rates to providers would be likely to become closer to parity with Medicare's. The health care bill requires Medicaid to pay the same rates for primary care in 2013 and 2014 as Medicaid to pay the same as Medicare. Reducing the gaps between Medicaid and Medicare reimbursement levels, which would be much more likely under federalization, would help to end Medicaid's status as a second-tier welfare-type program, improving the quality of care to beneficiaries in the process. Back in 1982, Ronald Reagan actually supported the idea of federalizing Medicaid. And today, even some conservative commentators like Reihan Salam and Tyler Cowen have endorsed Medicaid federalization, in part because they recognize the idea's potential to liberate states from their suffocating budgetary burdens. I really believe that the attention that Congressman Ryan has called to Medicaid presents an enormous opportunity to try to turn his ideas on their head and get people to see that the direction he's taking is wrong and we need to move in the opposite direction. Thank you.
Randall Dodd with the Financial Policy Forum.
Thanks, Richard. I should say first that I recently changed jobs. I moved from unemployed, Steve would like to hear this, to being employed. But I'm now in the Department of Treasury, so I have to also say that what I'm about to say reflects just my own opinions and in no way reflects the opinions or views and so forth of my employer. Having said that, I'd like to pick up on how we ended the second session when Gary was talking and address a little bit about how we finance municipal debt, because it is part of the story. It's a story a couple of ways. One, although it's one part of the municipal debt reflects the part of municipal budgets that doesn't have to be balanced every year, that is a capital budget. Nevertheless, the interest payments on that debt do factor into current expenditures and do impact the current budgets. So that's very important. And what I want to talk about today is how that really fits into the current muni crisis. And I want to do it by focusing on two things. One, the traditional inefficiencies of the municipal bond market. Two, how they led to the fragility that they became part of the financial crisis a couple of years ago. And then talk very, very briefly, because I only have a few minutes, about some remedies to solve this. Gary mentioned one, which was BABS. The inefficiency, you may not be familiar with the muni bond market, but it's not like a stock market at all. It's far, far less efficient. In fact, it's one of the most inefficient parts of the financial system today. It's not traded on an exchange like a stock, a future, or some of the options. It's traded over the counter. So it's very dependent upon the dealer community. That also means it's much less transparent. One of the results is it's going to cost you more to buy and sell a bond. Aggravating that problem is that it's a very heterogeneous market. Today there are 50,000 different municipal bond issuers in the United States. They issue 2 million different securities. Right? That's a lot higher orders of magnitude of just thinking of 500 stocks in the S&P 500. Right? So you've got it, or 4,000 in the Wilshire. Right? So this is 2 million different issuances. So it's a very fragmented market. The average trade size is very small. In fact, more than half the trades are less than $25,000 in size. So it's a much different type of market, and yet it funds most of our public infrastructure investment in the U.S. State and local governments are what do all the infrastructure investment, it's not the federal government. And so we're funding ourselves through a market that's not the stellar part of our financial system. To further aggravate the problem, we incentivize this by making it tax exempt. But what's the consequence of that? It means the only people participating in the market are a few, although very rich, high income individuals who are subject to U.S. tax action. If you're a foreigner, if you're not subject to U.S. taxation, if you're not in the top income tax bracket, you do not want to buy a municipal bond because it's not tax advantageous for you. So when everyone else is moving to a globalized capital market, this market is still constrained to a very narrow share of that global market. And as a result, again, it's much less efficient. What's more, a lot of the municipalities don't take this seriously because they're small, they don't issue bonds every quarter, every year, maybe not every several years. They don't negotiate very aggressively with the broker-dealer community. And so when it comes around to rolling over their bonds, someone comes out from Morgan Stanley or Goldman or some smaller broker-dealer and negotiates with them. They say, we'll help you raise the $10 million for your schools. And they say, great, we can get you, because of tax advantages, we can get you, 50 basis points lower than Treasury, hot dog, and we'll throw in a trip to Vegas on lap dance. Right? And so turns around, the deal comes off, bond hits the market at 50 basis points below Treasury, and then within 2 days, it's trading at 102, 103% of its value. Why? Because the broker-dealer misbid it. And so now the community's left money on the table, and the broker-dealer's cleaned up. And that's, again, impacting our current budgets. Right? So this has been going on for a very long time. The MSRB has tried to improve it, and just recently they've improved pricing transparency to a great extent by requiring all the bond prices to be posted within 15 minutes of the trade through the MSRB. You can go online and get it for free. That's been a great help. You can see some of these tobacco bonds issued by municipalities in New Jersey, for example, go off and hit the market at 105, 107% of their principal within a few days after being issued, so that at least now you got ripped off. And that's going to, in the long run, put more pressure for the munis to negotiate with the broker-dealers to drive that back down and to protect against that malfeasance. But the consequence of all that, both the high bid-ask spread in the market through the illiquid trading and this sharp trading practice, if you will, by the broker-dealer, drives up the yield on municipal bonds higher than it otherwise would be. And that higher yield means a higher cost of investing in infrastructure, and that's what we're talking about here today, right? And that interest service on that higher yield to finance the infrastructure that we're not getting competes for wages and other current expenditures in our budgets. So how are we going to fix it? Well, one thing they came up with about 5 years ago was called the synthetic fixed rate refinancing. And what they did was the guys came out from the broker-dealer community and said, well, you've been issuing 10-year bonds, and that's all well and fine, but now we've got a deal where we're going to issue an auction rate security, and then we're going to swap you back into LIBOR times 0.7, and that'll give you a better synthetic fixed rate than you're getting on your actual fixed rate debt. Let me try to explain this very quickly. So for years, you're issuing a 10-year bond, had a fixed rate coupon of 50 basis points below similar 10-year treasury. And you just pay that on out and everything's fine. The cost of that financing, maybe you pay too much, but it's constant through the life of the 10 years. Now they're saying, well, the problem with that is it's very illiquid, people don't want to buy it, blah, 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 blah. We've got a better idea. We're going to tap into that money market mutual fund money. Hot money, granted, but we're going to offer them a short-term instrument. It's called auction rate security. Interest rates reset every week, every 2 weeks, maybe every 4 weeks. Now, you don't want to hang on, you don't want to finance yourself through short-term interest rates because that's too variable. So we're going to swap that into a fixed rate, but we can do that fixed rate at a lower fixed rate than you would have got on the bond. And that's going to save you 50, maybe 100 basis points. You think hot dog, okay? Now, in order to do that, though, we're going to have the auction rate security, we're going to have to do the swap, and you're going to have to get a credit wrap by one of these monoline insurance companies because you're going to need to be AAA to do that. And right now, you're only, AA. Now, keep in mind, for example, what AA means in the muni market. I know that the credit rating agencies are under a lot of grief these days because they overrated all these structured credit products, credit derivatives and mortgage-backed securities and CDO squareds. But in the muni market, they systematically underrate municipal governments. Systematically. You compare the default rate on a AA muni, and it's better than a AAA corporate. If you, in fact, look at the default rate on a 1A muni, it's about the same as a AAA corporate, right? But because they're not AAA, they got to buy a wrap. And who do they buy the wrap from? AMBAC, MBAA, these kinds of crowds, right? You think, well, okay, it doesn't cost too much. Well, it still saves me money once I swap back into that fixed rate, okay? And don't forget about lap downs. So the problem came that these same monoline insurance companies that were giving them the credit wrap also went out into the market and they did a lot of sold a lot of credit protection on these structured credit products. And that, my friends, is how the financial crisis comes to the muni market. Because once MBIA and AMBAC and those guys blew up because they had sold too many credit swaps to wrap around these CDOs and some of the more exotic RMB, residential mortgage-backed securities, once that blew up those insurance companies, what happened to the credit wrap? Credit wrap became worthless. So now you pay for something that's worthless. But what's more, now you've got these long-dated auction rate securities out in the market that are 30-year bonds, but they reset every week or every 2 or 4 weeks. And then you've got to swap them back into fixed. But now the credit wrap is broken, and there's no one else out there to do the credit wrap because everyone who gave the credit wraps, they all made the same investments, they all blow up at the same time. Now the auctions are failing. And instead of those rates being, around LIBOR, around 30-day treasury bills, now they shoot up 7, 10, 15, whatever the default rate is. Now that is expensive debt. And what's more, your swap is no longer a hedge because what's resetting the swap is not what's resetting your auction rate instrument. So now all of a sudden what saved you 50 basis points, 100 basis points a year is costing you an insane amount of money. It's okay. The banks have an idea. They come back out. They said, we're going to, monolines blew up. Who would have thought that would happen? We're going to do the following. We're going to refinance these into variable rate demand obligations. And these are going to remain liquid. They're not going to be an auction anymore. These are going to be puttable bonds. And we banks are going to provide a credit guarantee, and you're going to put it back to us in case there's a liquidity problem. And that'll solve this illiquidity in the auction rate security market. Well, that worked fine for about 3 months before the banks blew up. And then those became illiquid, and the same problem emerges. So that has had the effect of really pushing a lot of these munis into aggravated financing costs on the effect of the, if you will, the Great Recession. And if you really want to dig down a bit, look into these Pennsylvania school districts and Jefferson County, Alabama, who doubled down. I don't know if they got 2 lap dances out or not, but they doubled down and they sold swaptions. Right, which gives you money up front in exchange for selling back to the broker-dealer the right to the benefit of a change of interest rates. And And it helps you in the short run because you get the option premium. In the long run, if indeed the counterparty exercises the option, then it's costing you money. So Jefferson County now, who initially was just trying to finance a sewer project, has now found themselves waist deep in what they were trying to get rid of. Because they did it all. They had the option rate, the variable rate, demand obligations. They've got the swaptions. And then I hadn't even got enough time to go into the constant maturity swaps. But hypothetically, everything can go wrong. And so this is part of the problem. Thanks, Richard. Let me just spend a few. I feel like Woody Allen. I don't want to, end on a positive note, but I don't have one, so I'll give you two negative ones. But no, I actually do have some positive stories. One, as Gary mentioned, we had briefly with the stimulus bill, the BABs, the Build America bonds. And what was brilliant about them is that they got away from this tax-exempt status, right, that made the bonds only sellable to this small subset of the global financial market, right? And it made them something that was investable to the entire global capital markets. And what's more, because part of the coupon on the bond was paid by the federal government, you got implicitly that bump up in credit worthiness because at least part of that value has got a federal guarantee. Not just a guarantee, but you're actually getting the federal money, right? So it's implicitly a federal guarantee. So you get a bump up in your credit worthiness, and you get access to a much greater capital pool, right? And that was a great innovation. What could also be added to that is we should think about doing to bonds what we did to derivatives, try to move them onto an exchange. Right now with electronic trading, it doesn't cost a lot to list anymore. Historically, when we had a trading floor, you had to build a kiosk and put in the equipment, then you got to have space. I mean, historically, the New York Stock Exchange had to, put trading booths in what was the garage, which I guess is the old carriage houses before that. Now it's electronic. You know what the New York Stock Exchange is doing? Now it's a new party room. They sell that on the evening for soirees because they don't need it to trade anymore. It's all electronic. So electronic trading makes listing instruments easier. So why not put these bonds on an electronic exchange? Europe is increasingly doing that. If you look at what the Deutsche Börse has done for Europe. And so that would make those prices more transparent, make the bid and ask quotes tighter together as people could buy them, sell them more actively. Maybe we could get some of that interest even in the algo traders to really bring in some volume and tighten that up a bit. Another thing you could do to improve the bonds is to look at what the state of Maine's been doing for a long time. It's called the Maine Bond Bank. Instead of having, 740 every little Middlesex village and farm in Maine issue a municipal bond, they apply to the state of Maine's bond bank for credit, and the state of Maine's bond bank issues the bonds. So you get a smaller number of larger issuances of standardized bonds with the notion now that they conform to a common accounting standard, which I wanted to mention earlier, but I talked over my own self. Because municipalities don't have a common accounting standard like GAAP. Some of them conform to GARP, but not all of them, and then the rest of them use systems that are unique to them, and so figure that out. So now you've got a Maine bond bank that's created a clear credit rating. They could get a credit rap if they wanted. You've got an accounting standard. You've got scheduled auctions like the Treasury does. I mean, you've got all those advantages of issuance that make a more standardized, homogeneous product that attracts more investor interest. Now, you could take that and do it for the other 50-plus states and possessions, and you could even do it regionally, or you could start even doing it federally. Right? I mean, there's different ways to reorganize that market to create a higher creditworthiness, a higher standardization, and hence, greater liquidity and lower borrowing costs for these cities and governments. Another thing you could do is, try to make sure, this is my last recommendation, is to make sure that these broker-dealers who are serving as underwriters, you have to have competitive bids for the underwriting services instead of a negotiated bid, because that all kinds of nefarious things get thrown into the negotiation, as I was joking about earlier. I'm sure there's a more appropriate joke, but I haven't thought of one. But and because the people I talk to in the market, that's what they keep telling me goes on, so I just repeating it. So you can have negotiated bids, and you can require them to have what's called not prudential, but fiduciary responsibility to the municipality, right? So they're supposed to act as though they're acting in the interest of the municipality, and of course that prevents you, it makes you liable for ripping their face off in some sharp deal in which, the bond goes off at 1, 2, 3 or more percent of its value in the market a couple of days after the issuance. So anyway, these are just some ideas I wanted to bring out there that I thought would add a little bit more dimension to this. In other words, the problem is more complicated than you thought.
Mike Lind with the New America Foundation.
Thank you. I'm aware of my responsibility as the last speaker of the day to keep my remarks brief, and I will. I think the way that this conference has been laid out is very useful and instructive. It began by talking about some of the problems in the relationship of this federal government and the states. And then particularly in this last panel, but in some of the earlier ones, we've been discussing some of the possible solutions. I think there is a kind of implicit consensus that I want to tease out of some of the remarks of some of the preceding speakers. Let me telegraph my results before getting into the reasons for it. I will propose that there is a plan that is an alternative to the sort of plans that are being discussed now for federal-state relations. One element of that plan would be federal assumption of activities that are done both by states at present, but also some that are done by the private sector with tax subsidies, tax expenditures. The other part of the plan would be some kind of revenue sharing. So those two ideas very briefly. One of the problems with our politics is that there is no national budget. Now, what I mean by national budget, this would show how much we spend on particular functions like healthcare and policing, the environment, unemployment, and so on, as part of a single pie chart where you have federal, state, local in each of these. We may have to break down and create one. I've hoped for years somebody would do this. But if we got in the habit, policymakers and policy analysts and the general public got in the habit of thinking about it in this way, we would realize that the division of labor among these levels of government, the federal, state, and local, in particular areas, is to a large extent a result of an accident of history. If you were designing a country, this is not the way you would do it. And since we can recreate the country in every generation, we have it in our powers. It's difficult, but we do every 30, 40 years. We actually come with a fairly radically different system every couple of generations. Then maybe we can reshuffle some of these functions among these different levels of government. So I think that all too often the idea of federalism has been associated with the right. I think people in the center and the left, can say, okay, we need a new federalism. One of but the goal would be not to hide what are essentially federal functions by shoving them under the carpet, right? So that you press it down here and then it pops up over here. And that's basically, I think, what the Ryan plan and a lot of these plans are doing. They're not actually cutting costs, they're shifting costs. They're shifting it to the states, they're shifting it to individuals, but that's like stopping the hole on one part of the water hose, and then it just squirts out somewhere else. You actually haven't solved the problem of leakage. If you thought of it in this comprehensive, integrated manner of a national budget, then you could have real cost control. And we've already heard from Stephen Atwell and from Greg Anrig that federalizing Medicaid and unemployment insurance, among other things, would be more efficient. It's actually cheaper. It makes a lot more sense. You free both of these programs from reliance on volatile state budgets, which crater much more than the federal budget does during recessions. And we're going to have recessions in the future as part of the regular business cycle. So this whole thing was a crazy scheme that we owe to Southern segregationist Democrats in the middle of the 20th century, who were in the states' rights neo-Confederate tradition. If we were designing it today, I don't think we would do it this way. But so it's a historical legacy, and it just makes sense to go in the direction. And it was very encouraging to hear from Greg Anrig that the healthcare reform does sort of move things along in that direction, at least in the case of Medicaid. So you have these functions that are shifted to the states that actually should be done directly and explicitly by the federal government. You also have an entire area of what the political scientist Christopher Howard calls the hidden welfare state. These are activities which, in order to make government look smaller than it is, are essentially delegated to the private sector, but with tax subsidies. Because without those tax subsidies, without those bribes from the taxpayer, this would not be done. And this is called the market or privatization, but there's no market here. You know, it's more like contractors, if you think about it that way. And the problem there is the least efficient parts of our imaginary national budget fall into what I think of as the subsidy sector. Actual direct bureaucratic government, which everyone is taught to think is, you know, terribly inefficient, the administrative costs are very low, it's very clean, it's very efficient. What are the greatest cost diseases that we find in our economy? It's not the market sector per se, it's not the pure government sector, it's the subsidy sector, and particularly the subsidized private health insurance sector and the subsidized private medical sector in general, which is subsidized through the employer tax expenditure for employee health insurance, and also the higher education sector, where you have somewhat cancerous costs. Just briefly, in 2005, before the present crisis, the U.S. spent 16% of its GDP, it's now more like 17%, on healthcare. The OECD average among similar industrial democracies was 8.5%. Compare that, it's about half as much. In spite of the greater resources poured into the U.S. healthcare sector, both access and outcomes are worse. According to McKinsey, drugs in the U.S. cost 50 to 70% more than in comparable countries. Hospital costs per day are 2.6 times more, and health insurance and administrative costs are 6 times as much as the average of Western Europe and Northeast Asia. And the annual growth of the U.S. healthcare sector's costs in excess of inflation is by far the highest in the world. Higher education, which has many glories, and you know, some aspects of our higher education system are among the best in the world, but it does suffer from this kind of health cost disease, arguably for some of the same reasons. That is, it's this kind of a hidden welfare state where you have public subsidies without any public cost controls. America's spending on higher education is far greater than that of other OECD countries at 2.9%, compared to an OECD average of 1.4%. And if you break that down, it's about 1.1% for the UK, 1.1% for Germany, and 1.3% for Japan, all of which are quite well represented in international trade and science and Nobel Prizes. While America's flagship universities are the best in the world, the U.S. has fewer college graduates as a percentage of the population, and college is more expensive than in most comparable countries. So there's a parallel here with what we see in the healthcare sector. Now, if I sort of did these back of the envelope calculations, how much money could be freed up for other economic uses if the subsidized sectors in the U.S. were as cost efficient as those in other countries? And again, this is pre-crisis data from before the crisis. If the U.S. were to spend the OECD average of 8.5% instead of 17% of GDP on healthcare, and the OECD average of 1.4% of GDP instead of 2.9% on higher education, the result would be savings of about $1.4 trillion a year. Not billion, the purely private sector. So that would be part of a program, I would submit. That is, the federal government does more cleanly and efficiently what things either it shares with the states now, like Medicare and unemployment insurance, or the federal government may not assume all of the responsibility for health care or higher education, but it could regulate what it subsidizes, whether it's health care costs or tuition costs. On the revenue side, the United States is going to have to raise taxes. I read the People's Budget. I was very interested in it. It seems to me it sort of gives in to the wrong message in the sense that we have to move towards a surplus rapidly, and they do it essentially by massive cuts in defense spending. The right does it by massive cuts in social spending. As a relic of the New Deal, I think the United States can afford guns and butter. We spend far too much on wars overseas right now. The United States can afford 2 to 3% of GDP, even when it's wound down these wars, 3 of them now, and it hasn't started anymore. If once we, in the ideal system, the U.S., which now has revenues in the area of 25%, spending, is just going to have to raise revenues, federal revenues, to 25%. It's right now hovers around 19%. The Republicans want to enshrine this in law. If you cut a couple of percentage points of GDP out of defense spending, which is now about 5%, it's really 6%, this is more than that, even 3 or 4% out of defense spending, you're a long way there to begin with. But it does mean you have to raise a couple of percentage points of GDP by new revenues permanently. And that's what we should advocate. And there are different ways to do it. For my part, I think that a national consumption tax, so particularly a value-added tax, is going to be in America's future if you're going to raise this much revenue, because I do not see it being politically possible to raise payroll taxes and or income taxes by themselves. If you look at other very progressive democracies in the world, they rely on a mixture of 3 basic taxes at the national level. It's a value-added tax, it's a payroll tax, and an income tax. There are concerns about the regressivity of value-added taxes, like all consumption taxes. But let me just make one point, and then I'll finish. Given the fact that there are enormous variations in wealth among the states, as Kathleen Newman pointed out in her presentation, even a regressive flat tax at the federal level can have a progressive effect if it's replacing equally regressive flat taxes at the state level, so that if you had a value-added tax and it were shared with the states, as has been done in Canada and Australia, 2 other federal systems that have adopted value-added taxes, and you replaced part or all of local sales taxes, then you could move in a progressive direction. It might not be the ideal of soaking the rich and redistributing the proceeds, but I think if you want to have a broadly based tax system that's sturdy and can fund a quarter of your GDP for the federal government and another 10-15% for state and local. And just to wrap up, I think that this plan envisions about 40% of US GDP going to government, federal, state, and local, permanently. And I think that's where we're going. If you control healthcare costs from growing above inflation, then aging alone, with no excessive healthcare costs, adds about 2% to Social Security and about 2% to Medicare over a century. The source of this is Douglas Holtz-Eakin, the Republican former head of the CBO. This is not, controversial. We can raise 4% of GDP over half a century through a combination of cuts, for example, some defense cuts, and higher revenues. But higher revenues have to be part of it, and that has to be part of the discussion. None of this is possible in the next, between now and the presidential election. It may not be possible in this decade. But what the right has done is it began in the 1970s with completely unthinkable radical ideas that even conservative Republicans rolled their eyes at. And then by the 1980s, these were moderate conservative ideas. Then they became moderate liberal ideas by the 2000s. This is a long-range program, but I think you have to have your maximal plan, your maximal program, and stake out that position before you begin to compromise. And I tell people I'm a short-run pessimist and a long-run optimist, and that's because I agree with Winston Churchill, who famously said, the American people can be counted upon to do the right thing when they've exhausted the alternatives. Thank you.
We have time for some questions if there are any. Yes. Yes. Mike. Right.
Hi, my name is Jean Athian. I want to disagree with the professor or Mr. Lind. our military budget essentially doubled over the last decade, and the U.S. now spends about as much as the whole rest of the world combined. Christopher Preble of the Cato Institute says that we shouldn't even call the current Pentagon the Department of Defense, because it's not about defending the U.S., it's about projecting power abroad. And so I would, I would take serious difference with you on the idea that we can have guns and butter. I think it's, and the wars only account for 23% of Pentagon funding, so that's a really small proportion. So, I mean, I think that it's important to continually emphasize that the reason that people pay so much feel that they pay so much in taxes here and get so little back is because so much of it is going to the military. And if you look at it, there's a chart that is included in one of the Cato publications showing how much Americans pay for the military individually as a part of their taxes compared to other countries, and we're like this and they're like this. And so it's no wonder that people have a sense that they're not getting anything for the taxes that they're paying, because it's going to military contractors and wars that we don't need. And if we don't change that, we're going to continue to, in my view, we're going to continue to be at a huge disadvantage when we talk about budget issues.
Mike?
Well, I understand your position. I opposed the Iraq War. I opposed the Libya War. I'd like to see these wound down. As I say, I would like to see defense spending cut maybe in half. However, you mentioned Christopher Preble in the Cato Institute. Christopher is a friend of mine. He's a libertarian. He not only wants to sink the Navy, he wants to get rid of Social Security and Medicare too. If you want to put together Rooseveltian social insurance with libertarian foreign policy, you can. But the fact is, liberals in the 20th century in the United States were in favor of a world role for the United States in foreign policy, where the purpose of the military since Theodore Roosevelt has not been to defend the United States from attack. It has been to influence the world order by preventing the Kaiser or Hitler or Stalin from dominating Eurasia, right? Now, because we don't have that kind of geopolitical threat now, I think we can have a much, much smaller military. But if you're going to have this, and this was the traditional liberal view, okay? This is not the libertarian view. It's much more expansive than the libertarian view. If you take the traditional liberal internationalist view, then you do want to have power projection. You do want the United States to dominate the global commons in terms of air and sea. You can do that without being involved with boots on the ground and nation-building activities, in various Middle Eastern countries. So while I agree that we can spend much less on the military, and just one more point on this, the reason I raised the people's budget, what is this thing about a surplus, right? Surely if the progressives are going to stake out a position against the far right, you have to get rid of this Andrew Jackson economics, where you have to get rid of, pay off the national debt and as quickly as possible and run a surplus. This makes no sense economically. So my concern is that you don't want to accept the right's framing of this and then say, oh, well, in order to get a surplus, we're just going to slash defense, instead of social spending.
Yes.
Hi. Very short question. Thank you. For Randall Dodd. Randall, I've heard a lot of discussion among financial market types lately about the muni bond market. We see a lot in the financial press. The story you're telling, is it largely a story that has come to an end with the crisis and all of that? Or is this one of the fields in which we're seeing some of the mega banks, engage and do new things, and so we should pay attention and really make a push for some of the reforms you're talking about?
Yeah, no, it hasn't come to it's almost like what Arturo Danto's comment about modern art. It's come to an end, but it doesn't mean it's stopped. So yeah, we haven't fixed this problem. The market's still quite inefficient. The Build America bonds is a great improvement, but now that program has been defunded, so that won't continue. They're not exchange traded. Dodd-Frank's done some steps forward on getting more responsibility on the part of broker-dealers. That's great. But we've still got a lot of overhanging problems. If you look at the Pennsylvania school districts, for example, look at Jefferson County, and there's innumerable municipalities around the U.S., and by the way, also in Europe on this. I have an article I did for the IMF on it called Municipal Bombs that talks about some of these exotic derivative transactions that were a problem. But moving forward, we need to go back to Build America bonds plus some other market innovations and try to build it up. If you trade a stock, the bid-ask spread now is a penny, and your commission's 7 cents. So you buy and sell less than $20, right, for a pretty good-sized transaction. For a municipal bond, you're paying a whole lot more. It's more of a 200 basis points to cross the market. And so instead of, roughly 10 basis points, you're up to 200 basis points. So that sort of thing needs to come to a screeching halt. And with better tax treatment and perhaps something like the Maine Bond Bank, you could really save a lot of money. And as people were talking about earlier, that's not just to get us out of the current hole, but that would be an efficiency savings that would be permanent and would help us all the way going forward. And I think that would be, but also it's the only people's ox you're goring then are the financial sector.
Yes.
Waiting for Godot or the microphone. This is essentially, to Michael. What are your thoughts about a progressively increasing carbon or gas tax? Slowly increasing, in order to, fund certain things?
Well, I think that there's a short-term question, long-term. In the middle of a near depression, you basically don't want to have contractionary actions. You don't want to jack up taxes and cut spending. I mean, that's the problem with austerity. In the long run, I think it's politically doomed. It's just not going to happen. And so whatever may be the case in other countries, I think that the focus needs to be on fuel efficiency and on the active promotion of efficiency, alternative energy research, and so on by the federal government. But there are certain things, as I said, you have to have kind of a utopian vision, to set things out there. But one thing I'm convinced, I do not see, massive gas tax increases justified on environmental grounds being enacted by Congress ever. Not in 10 years, not in 20 years. In fact, what you've seen is a lot of this international effort with the Kyoto Protocol and with the Copenhagen Agreement, it broke down because nations, even authoritarian nations, are sensitive, to their citizens, and this would inflict such pain, short-term pain on citizens for a very long-term goal that it seems to me you have to think about Plan B and Plan C. It's a political analysis.
Yes.
Hi, Susan Ozawa from the New School for Social Research. There seems to be a lot of pragmatic ideas on the panel, which I definitely appreciate. And harking back to Professor Newman's presentation on kind of the realm of options available to us in terms of revenue generation, it seems like sales tax seems to be the way, so this points at kind of Michael Lynn's program and a value-added tax. What I'm wondering is if anybody has floated the idea that you've heard of a luxury goods tax. That seems to be something that's not regressive. And ideally, of course, it would be great to have a luxury goods tax on foreign goods that raises all kinds of flags with respect to free trade and all of that. But I was wondering if maybe you run numbers on that or anybody had floated that.
Well, a value-added tax is a luxury goods tax if you exempt a lot of food, necessities, basic clothing, which almost all countries that have value-added taxes do. That's why their rates are so high, by the way. So that you could raise the same amount of money by 5% value-added tax if it fell on food and clothing and so But if you then exempt all of those things, then it becomes 10 or 15% rate. But that's so it's a kind of a de facto a luxury tax, the way it's designed in most countries. Economists hate this because they think you should have a no exemptions whatsoever, and then you should have a rebate that everybody gets to compensate for the regressivity. All I can say is that reasoning has not persuaded most of the countries in the world. They have lots of exemptions.
I'll just add there is in a sense a luxury abatement in the form of the tax favored treatment of capital gains and dividends, which is almost exclusively collected by the very wealthy and the wealthy. There are very few people earning under $100,000 a year who pay taxes on capital gains and dividends. To the extent they collect them, they're in retirement accounts. And you can raise, if you want to try to raise a lot of revenue, that's a very efficient way of doing it. And there are actually a fair number of relatively conservative people who think that that's, going after tax expenditures like that is at least something worth looking at, and including, the Bowles-Simpson plan looks at that sort of thing. So, at least in the shorter term, looking at tax expenditures as a way of collecting revenue. I know Jamie doesn't think we need to close the deficit in any capacity, which is in the short term certainly true. But politically, I think there may be some action there, and it could be significant.
We had a luxury goods tax in the '93 OBRA, right? Richard, you were at the JEC then, I think. And so we've had it. I forgot when it was repealed, but we had it through most of the '90s.
I left in '92.
Oh, I'm sorry, Richard. I remembered either when I got there, I didn't remember exactly when he left, but the 1990 Budget Reconciliation Act under Clinton had a luxury goods tax, and it hit yachts, fur coats, cars over $50,000 or $60,000. But I forgot when it was repealed.
We have time for one more question.
My name's Thomas Hanna from the Democracy Collaborative. While we're talking about increasing revenue, I would just like to ask the panel what the panel's opinion would be on closing corporate tax loopholes and corporate tax avoidance, and what impact that would have on state and localities primarily.
Huge.
Anyone else?
Think GE.
Yeah.
Well, I'll be the outlier here. I think that individuals should be taxed, not corporations. If it's in your interest as part of a plan, local and national economic development to have the corporation doing business in your jurisdiction, then why do you want to punish it, right? And besides, the thing is, there is no such thing as a corporation. I mean, it's individuals. This either goes to the shareholders or it goes to the managers, right, or employees. So the rational thing to do is to have higher taxes on the rich, right? The reason why Congress likes corporate income taxes is because it can therefore have lower rates on individuals than it would have otherwise if you simply taxed this. But I think that progressives in particular really need to rethink this idea that corporations are bad. I mean, the reason we have corporations is because they're doing functions that we would want done anyway if they're useful to the economy, right? Like manufacturing things and providing goods and services. It would be more expensive to have a government agency paid for out of taxpayers doing it. But if we had to, we could do that. I mean, we could manufacture, with state enterprises if we had to, so.
But Michael, they've got, limited liability, and they can have inside buildup of earnings that wouldn't be taxed, and so there's a lot of,
Well, you can structure the, no, I granted that, and you want to punish, avoidance and evasion, okay? But it does seem to me that there is genuine tax competition among nation states now. All of the left-wing social democracies of Europe in the last decade have drastically cut their corporate income taxes. It does appear to be the case that just as you have this race to the bottom among states within the Union, you have this international race to the bottom. And I think we have to consider the consequences, if we decide not only to keep the highest nominal, corporate income tax in the world, although it depends on the industry, whether you pay it or not. We just have to ask, do we want them to do business in this jurisdiction or not? They have more alternatives now.
Well, on that note of vigorous debate, we're going to end up this panel. And Jamie, do you want to make some closing remarks?
Well, I'm tempted to make a few substantive comments, but I will resist that temptation. Simply say that we have proceeded in a very methodical way through rebuttal, analysis, and proposals. And I think we've informed that discussion with something that is truly valuable, which is an element of particularly deep historical and political understanding to try and inform both the problems we face and the politics of the choices that we are trying to make. And this, it seems to me, is an essential ingredient if we want to to use a word that I'm fond of, if we want to develop a truly strategic approach to an economic and political alternative, something that we can refine and advance over a period of time so that it becomes a truly credible alternative to the almost incredibly dysfunctional economic policy debate that is now going on. I would like once again to thank Bernard Schwartz for the support he has given to this process that has made it possible over a number of these sessions and more still to come to engage in this dialogue with the Washington policy community. Bernard, if you're watching, thank you very much. I'd like to say again a particular word of thanks to the New America Foundation, which both developed the model for this kind of event and has been our partner in organizing them. I'd like to thank the panels and their chairs, Richard Kaufman and Cheryl Schwinninger, particularly for the marvelous job they did in keeping this program on track and on time. And then I would like especially to thank the people who actually did all the work in putting the program together and in organizing it. And that is, first of all, Mike Valenti, our intern, Ellie Warren, and Taya Harvey, the director of the Times Edition Security. And I would like to thank you in the audience for coming and for sticking with us, and for those who watched it online, thank you as well. We are adjourned.
Thank you.